So the next topic that we are dealing is medical asepsis and surgical asepsis. This topic I am sure you have studied in foundations of nursing. So I will not be taking this in detail, just a brief introduction about this topic, what is medical asepsis and what is surgical asepsis, I will tell. And most of the time this question is asked for 2 marks. Okay, they sometimes ask the difference between medical asepsis and surgical asepsis. So first of all, before moving to what is medical and surgical asepsis, we will see the definition of asepsis. So asepsis means freedom from infection or prevention of contact with any microorganism, so that the asepsis is sometimes also referred as a state of being free from any disease causing microorganism. Okay, that could be your pathogens like bacteria, virus, fungi, or even the parasites. So that is a definition of asepsis. It is a state of being free from the microorganism. And most of the time, the goal of asepsis is to eliminate infection and not to achieve mostly sterility. But in the surgical field, you should always be aware that you are trying to maintain a sterile environment, okay, so that that will prevent infections in the individual. Next is moving on to the types of asepsis. We have got medical and surgical asepsis. Now, what is the purpose of asepsis? Why you need to maintain aseptic technique? Now, most of the time, the reason to maintain asepsis is so that you will prevent infection in the individual, okay, or it will keep the patient or the person away from any reinfection from the same microorganism, or sometimes it will prevent the occurrence of infection because of a fresh pathogen. That also is one of the purpose of asepsis. And most of the time it will protect the patient, or it will also prevent the healthcare worker from any infection. Okay, and sometimes it will also prevent the occurrence of cross infection, or sometimes it will also protect the individual from nosocomial infection. So these are the major purposes of asepsis. So first of all, you should know that asepsis is mainly done to protect the individual, that is a patient, and also the healthcare workers. Next, we will move on to what is medical asepsis. Now, medical asepsis mainly refers to the practice that is done to protect the patient as well as the environment from the transfer of microorganism, so that you will not get any sort of cross infection. That is why you are doing medical asepsis. When you are doing any medical procedures, you usually follow this medical asepsis. And in medical asepsis, our main goal is what? To reduce or to prevent the spread of the microorganism. So what you should do first and foremost to prevent the spread of microorganisms, you will have to perform hand hygiene. Hand hygiene in the sense hand washing, because hand washing is the first line of defense. Okay, so thorough or systematic hand washing has to be performed at least for 20 seconds. A thorough hand washing should be done. You are already knowing how to perform hand washing. You have to wet your hands well, you have to use the soap solution, and nicely how to rinse the hands, isn't it? So when you will do hand washing has to be done before you do any procedure, especially if you have coughed or sneezed. Immediately after that you will have to perform hand washing, or if you have used bathroom, after that also you will have to do hand washing. Sometimes if you have touched any contaminated items, after that also you have to do a thorough hand washing. Suppose you have handled body excreta, that is any blood or body fluids you have touched, even though you have gloves, after that also you will have to perform hand washing. So always remember, hand washing is a must. So immediately once you have used gloves or you are removing the gloves, in that case also what you have to do? You have to do a thorough hand washing. Okay. Next is moving on to surgical asepsis. Now surgical asepsis mainly refers to all the procedures that is done so that the environment will be sterile, so that it will be completely free from all the microorganism. Okay, so remember that medical asepsis is done why? To prevent the pathogens or to prevent the microorganisms from entering the body. But surgical asepsis is done to completely eliminate or stop the pathogen and non-pathogens. That is first main difference between medical and surgical asepsis. The next difference is medical asepsis is a clean technique, while surgical asepsis is a sterile technique. That is also one more difference. So these differences you can write for the exam if they have asked difference between both of it. Okay. So remember, medical asepsis is done to prevent the pathogens from entering, while surgical asepsis is done to eliminate both pathogen and non-pathogens. And medical asepsis is a clean technique, while surgical asepsis is sterile technique. And surgical asepsis refers to sterile technique that I have already told, so that you will eliminate not only pathogens but also non-pathogens or even the spores. Next is principles of surgical and medical asepsis. So first main principle is a thorough hand washing, as I have told. Okay. So hand hygiene or hand washing should be performed for at least 15 to 20 seconds. Whenever you are doing hand washing, do not touch the basin, okay, because the basin is considered as unsterile here. Then separate clean items from dirty ones. Don't mix dirty items and clean items when you are performing the asepsis. Next is always see that you're removing the moisture, because excess of moisture will result in growth of microorganism. Next is whenever you perform hand washing, or whenever you're doing aseptic technique, see that you're removing the jewelry. Okay, because if you put the jewelry and if you are doing any procedure, it is surely going to result in contamination. Next is you can also use the PPE, that is personal protective equipments like gown, mask, gloves, goggles, boots, all this can be used well. Then always see that you are cut shorting your nails. Your nails have to be short whenever you are working. Okay. Next is if using any hand lotion, it allows the hands to dry out about 30 minutes before applying. Okay, so see that before you are applying, after see that if you are having problem with dryness of your hands, you have to apply the hand lotion. So before doing the hand washing, you need not apply the hand lotions. Next is do not mix soiled linen with other linen. So that we are already aware. If you are planning to discard the soiled linen, don't mix both the linen together. Next is dispose the soiled items in their containers. So I know that all of you are thorough regarding biomedical waste management. So discard all the soiled items accordingly. And one more is important thing, avoid leaning against sink, bed or any other equipments. There is one habit particularly which is seen, that all the students or even the staffs and all, they have a tendency to lean. Okay, so avoid leaning against any of this equipments, and avoid touching your face or eyes and mouth frequently with your hands. Okay, because your hands can be contaminated. Next is all the body fluids of the patient should be considered as contaminated. So if at all you come in touch with any of these, what you have to do, immediately you have to perform a thorough hand hygiene. So this is particularly about this medical as well as regarding surgical and surgical asepsis. So in detail you can study again in your foundations.